Hello and welcome to another episode of In Good Health with McLaren Macomb. I'm Toya Hankins. Today we're going to be joined by emergency room physician, Dr. Julie Lata. And we're going to be discussing common summer conditions that just might find you in the emergency room. And then we're going to head out to the 2019 Let's Move Macomb Festival of Races. But first we're here with Dr. Timothy Logan to discuss why you should call 911 with any suspected heart attack. Can you tell us a little bit about interventional cardiology?
Sure. Interventional cardiology is a subspecialty of cardiology. So we do regular patient office visits and those sorts of things, but we also do procedures that can treat blockages in the arteries of the heart. Okay. So if somebody was having a heart attack, we can stop the heart attack with balloons and stents.
Okay, very good. So are there warning signs that people should be aware of if they are experiencing a heart event or a heart attack?
Absolutely. The most common symptom, we tell people if they read the book on having a heart attack, they would describe chest pressure or chest heaviness, usually located in the middle of the chest. People often say it feels like someone's standing on them or an elephant is sitting on their chest.
Okay.
Usually associated with shortness of breath, sweating, possibly nausea, upset stomach, sometimes even vomiting. Okay. That's the very typical description of a heart attack.
Do you think people misread their symptoms sometimes?
Often.
Okay.
So that is a typical presentation. Oftentimes people have atypical symptoms, particularly females and elderly patients will have what we call atypical symptoms. So maybe not the chest pain or chest pressure, but they might just have shortness of breath, or they might just have heartburn or upset stomach or fatigue. Mm-hmm. So it's not always crystal clear. Sometimes it's hard to decipher.
And is it a combination of those things, or or how many of those things in the list would cause someone to realize that they need to react and take it seriously? Because we're talking about nausea and maybe you're tired and having chest pains. Like, it seems like those are symptoms that might be easy to write off. How is it that someone might recognize I need to get help?
There's generally a spectrum. So some things are subtle and more are just crystal clear, crushing chest pain.
Okay.
The most important thing that we preach is if you are not feeling good and you're not sure, then you should call for help.
Okay.
Because we don't want people to sit at home, and it's typically men sit at home and say, I'm fine, I'm just not feeling good. Mm-hmm. But we don't want, it's difficult to decipher, even sometimes for physicians, so we don't want patients sitting home trying to figure it out on their own. So if you're not feeling good, just seek help.
Okay. And seek help by calling 911 or, just make your way to the hospital or to your doctor. What would you recommend?
So we make the big push that if you are having symptoms where you think you might be having a heart attack, you should call 911.
Okay.
If you're having chest pain, shortness of breath with sudden onset, you do not want to sit at home and you do not want your family to drive you. If you drive yourself to the hospital, there's a couple problems. Number one is you could continue to get worse on your way to the hospital, and then you might need an ambulance and you're on the side of the road somewhere.
Right.
You could even have cardiac arrest in the car. If you had called 911 and you were in the ambulance, they have the tools to resuscitate you and care for you and give you medicine, hopefully to prevent that from happening, but if it does, they can handle it.
Yeah, that's a very good point. When the emergency teams show up, they're already trained to assess your situation.
The treatment has already started.
Yeah.
And then they also know which hospitals to take you to.
Okay.
Because not every hospital provides interventional cardiology, only certain hospitals do. So if you walk into an urgent care or you walk into a hospital that doesn't have interventional cardiology, they're going to have to transfer you. But the ambulance services know which hospitals those are, so they can...
According to your symptoms.
Right, according to your symptoms. And a lot of them now, most of them really do an EKG or an electrocardiogram right in the ambulance, so they can get an initial assessment of your heart function to see if you're having a heart attack that needs emergent treatment. Okay.
So now walk us through the process. I'm feeling the chest pains and have a number of symptoms. I decide to call 911 and the EMT picks me up, brings me to the hospital. What happens next?
So when you're in the hospital, like I said, a lot of times we have the EKG prior to getting to the hospital, and they activate the team to be ready to have that patient go right to the cath lab for their procedure. So there are different types of heart attacks. The worst heart attacks are called ST elevation myocardial infarctions, or STEMIs, that's what we call them. Those patients need to go to the cath lab right away, and the sooner we can get them to the cath lab, the better they do. So if that is what you present with, you will go to the emergency room. If you probably had an aspirin already, we encourage people to take an aspirin, 325 milligrams at home right away if you're having chest pain.
Okay, and is it chest pain that would trigger that, or would it be high blood pressure that is sustaining?
Primarily chest pain.
Okay.
If you think you're having heart attack or stroke-like symptoms too, take an aspirin.
Okay.
But once you get to the hospital, if it is one of those STEMIs, they will basically repeat an EKG, get an IV started, and get you to the cath lab as soon as possible.
Okay.
Where you'll likely meet me or someone like me. So heart catheterization is a procedure where we use catheters.
Okay.
So it's basically like an IV, a bigger IV. We put them either in the wrist or in the groin through the blood vessels, and then the catheters go through your blood vessels to your heart, and we take pictures with contrast dye and X-ray.
Okay, and is that when you determine if you need a balloon or some?
Correct, and then if one of the arteries is blocked, we can cross that blockage with a wire, and then we open it up with a balloon and put a stent in, which is a metal scaffold that helps prop open the blood vessel.
Okay.
And usually then your heart attack is done.
Wow.
So it can be very quick, very quick. Oftentimes patients feel so good after we do the angioplasty and stenting, they ask when they can go home. I said, well, you did just have a heart attack. You're going to have to stay a little bit.
Right. So now, do you think people carry symptoms around for a while before it becomes emergent?
Frequently, yeah. A lot of times the symptoms will be subtle and less severe.
Okay.
So when we see the patients that come in emergently and go right to the cath lab, the first question we ask is, when did it start? And they may say about 2 hours ago or something similar to that. But then when we ask them further and say, well, have you been having this for a while? Well, yeah, actually, the last couple weeks I haven't been feeling that great. It just wasn't that bad. I thought I had heartburn. I thought I might have had the flu. So it's frequent. Sometimes it's just out of the blue, but oftentimes patients, more often than not, they've been having some symptoms for a while.
Okay. And if they are aware of the symptoms early on, then is it just medication or maybe some lifestyle changes that could prevent, the onset of a heart attack? Or
if you present early enough, we treat the risk factors. If you don't need anything, if you don't need a heart catheterization right away, you may just need a stress test or an evaluation by your doctor. So we treat the risk factors like high blood pressure, high cholesterol. You can treat with medication. Certainly stopping smoking is one of the big problems out there that still exists. So not smoking is big. Controlling diabetes if you have high blood sugar, treating that with medication and diet and lifestyle, exercise are all very important. So there are things you can do to prevent this from happening. So that would be ideal. If we could do that for everyone, that would be great.
Yeah. So would you say one of the lessons here might be to really listen to your body?
Absolutely. So listen to your body, understand the symptoms and learn the symptoms, and don't be afraid to get help. Yeah. People often say, well, I didn't want to call and then it wasn't anything. Now I always tell patients, it's better to call and find out it's nothing than not call and find out you missed it.
That's right.
Because you don't want something to happen at home where you could potentially die at home.
Well, Dr. Logan, this has been very insightful. Thank you so much for the information.
You're very welcome. Thank you very much for having me.
Thanks for being here.
To learn more about cardiac care at McLaren Macomb, visit mclaren.org/Macomb Heart.
And now let's head out to the Let's Move Macomb Festival of Races.
Let's Move Macomb Festival of Races. It's our 9th year. There's so many people that help pull this off. The Macomb County Road Commission does a huge job organizing all the pieces that need to go in place. From there, the Sheriff's Department does a wonderful job with our public safety. And then they pull in the resources of MedStar, the Harrison Township Fire and Rescue. It's truly a teamwork that pulls this off. And without any one of those, it wouldn't be the event it is. McLaren has always been our primary sponsor. We also have Oakland University Macomb, Hanson's Running Shop, American Home Fitness, LL Bean, Health Quest. But McLaren has always been the backbone of this event. Again, we're in our 9th year. It features a half marathon, a 5K, a 10K, and a 1-mile fun run. And it's for all ages and all abilities. We'll get serious runners that have been training for months getting ready for this, and we'll have others that just decided to wake up and come walk a 5K. The half marathon is going to take the spillway all the way to Jefferson. It'll do a little loop around Lake St. Clair Metro Park, and then it'll head north on Jefferson to South River Road, and then take that back to Mount Clemens.
There's a lot of individuals that use this as a stepping stone with the spring and summer coming up, so they look forward to this race to get the season officially started. I see for those individuals who are not able to participate, you can still donate online.
The website that has all the information regarding the event is www.lmmfor.com.
This year we have 3 different charities: Leadership Macomb, Macomb Food Program, and Friends of Foster Kids. Those 3 organizations will receive 1/3 of the profit after we've paid all of our bills.
And now we're here with Dr. Julie Lata. Hello, Dr. Lata.
Hi,
Thanks for joining us.
thanks for having me.
So tell us about what you do.
I'm an emergency medicine physician at McLaren Macomb, located in Mount Clemens, Michigan.
Okay. And emergency medical physician, so you have to know a lot of stuff. So warmer temperatures are approaching, which
Hopefully
is great.
soon.
Yes, hopefully it'll stay around. And so I'm curious, do you see different kinds of illnesses in the emergency room during the summertime than other times of year?
We absolutely do.
Okay.
We tend to see more traumatic related events in the summer.
Okay.
I think just because people are more active, they want to enjoy the limited time of nice weather that we get in Michigan. So a lot of times we'll end up seeing more motor vehicle accidents. With our proximity, particularly to our hospital, we'll tend to see some boating-related accidents as well.
Okay.
Unfortunately, we also get a lot of exposure to drowning-type events and victims. But in addition to traumatic-related things, we'll tend to see a lot of environmental-related issues as well. Some of them can be related to heat stroke, which typically occurs secondary to just getting really, really hot.
Mm-hmm.
So
And do you see that more in children or seniors or a little bit of both?
there's extremes of age is what we consider it. So usually the elderly, which would be considered, a lot of people aren't going to like this, but over the age of 65. And pediatric patients
Okay.
are more prone to their body just not being able to handle the extreme heat. They get dehydrated faster, and their body can't compensate to keep what you need to stay hydrated.
Mm-hmm. And so would you say you see more of any particular kind of incident in the hospital than others?
Probably in the summertime, dehydration, heat stroke, and rashes would be very prevalent, common occurrences that we see. And a lot of them are just because people are outside trying to enjoy the weather,
Yes.
which we definitely want them to do. Getting exercise is certainly of utmost importance, but making sure that you're doing the appropriate things while you're outside as well. So wearing sunblock is super important. We see a lot of people come in with bad sunburn. When you do that, it also can lead to dehydration because your body doesn't have the water supply that it needs. And making sure that you're staying cool. So even if you're outside and enjoying being outside, make
Take
sure
a
you
break.
take a break, go inside, find a cool environment, have a multiple large bottled waters by you, or access to being able to drink water to help prevent ending up in the emergency room and being really sick.
Do you think it's a good idea to keep Gatorade or Pedialyte or things like that around to keep kids hydrated while they're playing?
It's never a bad idea. Especially kids, I don't think they realize what they need. So usually, I think if it's a little bit more accessible to them and they see it there, then it might remind them that, I think I am a little thirsty, or I need to take a sip now. And certainly staying away from excessively sugar drinks, so pop would not be a good idea.
Right.
But Pedialyte or Gatorade is good because it does have the electrolytes that can help to replenish them and keep them hydrated.
Okay. And so do you see more instances of children, or do you see a fair number of adults, just not seniors necessarily, but just adults that are presenting with issues in the summertime as well?
Just based on our hospital alone, we have a higher patient population overall of adults. We see pediatric patients. Probably about 20% of our patient population is pediatric-related cases.
Okay.
I'm not entirely sure if we see more of them in the summer compared to the winter, but we will still tend to see more adults in the summer than we will kids.
Okay. I remember being a kid and hearing, things like, if you bump your head, don't go to sleep right away, stay up so we can monitor you. If a bump develops on your head from a bump and fall, then it's time for us to go to the hospital and get it checked out. Are there guidelines like that parents and patients should know about to help them decide it's time for me to go to the emergency room, or I can take care of this at home?
Whenever there's a head injury with anybody, whether it's an adult or a kid, it's very case specific. There's no two circumstances that are the same. There are definitely guidelines, especially specific to kids with head injuries, that we evaluate from a physician standpoint. But I still think if there's any concern, it would probably be best to be seen by a physician.
Okay.
Since each case has different factors that could change the way we evaluate them.
And it's better to be safe than sorry.
Absolutely.
Yes.
When it comes to rash-related things like we were discussing previously, rashes, sometimes they can begin in one area, but if they start to progress and involve larger areas of the body, so maybe it originally started on the hand or on the arm, and now we're noticing it's on the chest and on the entire abdomen. If we start having any swelling to the lips, swelling to the tongue, there's significant concerns at that point that someone's airway could start to be closed off.
Okay.
And that is definitely a time to seek evaluation in the emergency room. So that would definitely be concerning for a life-threatening issue. With kids and head injuries, or any adult in head injury, if anybody's on any kind of blood thinning medication, we always get concerned.
Okay.
Even something simple as aspirin, a lot of times people don't realize it's a great medication that protects the heart. It protects the heart because it thins your blood. So if you fall downstairs and bump your head and you think it's just a simple bruise, it might be more than a simple bruise. So anybody with a head injury on blood thinning medications, we always recommend coming to the ER, being evaluated. Any head injuries with a loss of consciousness is more concerning. If there's any amnesia or loss of memory, difficulty walking, vomiting, or if the person's personality just doesn't seem like the way they normally are, we definitely recommend seeking further evaluation.
Well, Dr. Lata, thank you so much. It was very insightful, and I know that our viewers Definitely took a lot away from our conversation today.
Thank you for having me here.
Learn more about emergency care at mclaren.org/Macomber.
Thank you for joining us for another episode of In Good Health with McLaren Macomb. I'm Toya Hankins, and we'll see you next time.
To watch this episode again, visit mclaren.org/Macomblog.